Welcome back to Taiwan Now Look. Our guest today is Dr. Sheng-mou Hou, Minister of Health, and we've been talking about Taiwan's international activities in terms of health. Dr. Hou, we've been talking about Taiwan's membership at the WHO and Taiwan's achievements over the years. And you mentioned earlier that Taiwan's national health insurance system is one of the best in the world. But there are also concerns about the feasibility or also the future of the national health insurance system. Do you share that kind of concerns in terms of financial balance?
We have financial problems, but it can be overcome. Let me share with you one of my honor. After my Geneva trip, I was invited by Johns Hopkins, my alma mater, to give me an award. For my distinguished government service. But the next day, May 22, I was invited by the House.
I see.
House
of Congress.
Yeah, House of Congress. And to have a Congress hearing, talking about universal medical coverage. Well, really, we have something we can be proud of, such as the smart card, the smart card or IC card.
Yeah.
In Taiwan, this smart cards is so popular that, say, 99% of Taiwanese people got one card.
Health insurance card.
Yeah, health insurance card. And it becomes an ID.
Yeah. Another ID.
Yeah, another ID. And it's so useful because through electronic data collections, as the Minister of Health, at the end of the day, I can tell you how many visits to the clinic of, in a day, Taiwan.
Yeah.
Or even I can tell you how many teeth are extracted within one day. So this kind of information collection, this kind of system is #1 in the world. It's #1 in the world. We are very proud. And this kind of know-how is very important. If any country wants to establish the same medical coverage, we love to offer our experience.
Yeah.
And I think because Taiwan is very proud of in our electronic computers manufacturer, but also we are very proud of our application of this kind of computer devices to our health system.
That's right.
Another thing is very funny. We published a paper in Lancet, which is a very international famous journal. Say, in Africa, because they do not have ID, and it's very difficult for the hospital to establish a patient record.
I see.
And sometimes the name is very difficult. Sometimes, the patient long name and their father's name and the son's name are mixed together.
Yeah.
And very difficult for the doctor to write the record and make records whether this patient has received drug or not. The ID identification is rather difficult in some countries. So we established a fingerprint method, ID. And it's so simple that you need only a table computer.
And scan.
And scan. And can establish an electronic databases for the small country, for the country.
Yeah.
So it becomes so popular and becomes so useful. And international journal recognize it and publish it.
Yeah, it sounds very easy, but Taiwan is the first country that introduced that kind of system, right?
Yes, it's the first country. And besides that, we are very proud of in our achievement in health issues. Let me tell you another story that in the past several years, our AIDS, the number of the victims increased very rapidly.
Yeah.
And I make an investigation and found out 2/3 of our AIDS patients are from drug users. They share the syringe.
Yeah.
So immediately we have a program we call harm reduction program. We offer the free syringes and we use the harm reduction programs by using the methadone to replace the heroin.
Yeah.
And then the AIDS, the incidence of AIDS dropped down dramatically.
Yeah.
But this kind of information or this kind of experience, we love to share the rest of the world.
Mm-hmm.
Yeah.
Mm-hmm.
So, you know, we come back to the WHO. Yeah, we want to be a member. Not only we want our part in the world, we want to share our experience.
That's
and
right.
it's not fair not letting our scholar or our professionals to, you know, to contribute our knowledge.
That's right.
Or to exchange our knowledge with the rest of the world.
In terms of, in addition to know-how, Taiwan is also very famous for its public health system as well, right?
Yes.
What's the most important contribution that we can give to the world in terms of public health?
Yes. You know, we have a very good system in recording and vaccination, you know, vaccination for the
right.
children. Yeah, we are also very good. Yeah. And also the maternal child health.
Yeah.
Maternal child, family planning. We have been doing very well in family planning.
Yeah.
And so we sent out a team to help Vietnam to perform their family planning. We got a lot of experience. And also don't forget malaria. Yeah, 30 years ago, we get rid of malaria. And last year I sent out one professor, Dr. Lian Zhiqing, Dr. Lian, who is an expert in malaria. And I sent him to St. Thomas Principe, an African country. And he went there and offered his efforts. And then the public hospital became empty. Yeah. Because the malaria patients dropped down in that country.
Which is good. Yeah.
Which is good.
Yeah.
Yes.
And let's talk about the future prospect of Taiwan's WHO bid. You know, do you have any plan that or any possible prediction that how long does it take for Taiwan to be a member of WHO?
Well, it's very difficult for me to predict in the future. But my belief is like this. If you are doing the right thing, and if you are doing a good things, you keep on trying, and you keep on telling people what is right, then finally it will come true. Yeah. Take China example. China to enter the UN, it takes 22 years or something like that. Yeah, before they enter the UN. So the most important things, we cannot lose our courage. We should keep on trying, keep on working. We keep on talking to the rest of the world that Taiwan is entitled to enter WHO by any way. Yeah, it's our right, and it's for the safety of the whole universe.
That's right. And finally, let me, Dr. Hou, let me ask you some personal questions.
Okay.
I know you'll be leaving the government quite soon, and after serving in the government for some years, what do you think that you have accomplished, and what's the things that you feel most proud of?
Well, after this, I'm returning to National Taiwan University to regain my former job as a professor in orthopedic surgery. I'm very happy because, it's just too tough. To be a minister. And
a lot of pressures, right?
Yeah, a lot of pressures. But, I talk to myself that, well, I have done what I have to do. Yeah, I have been working very hard, and I know I'm doing good things. And after that, I can be a very good professor, even in my university. I can care about the national issues. I can offer my personal contribution. Especially, I'm extraordinarily happy because the successor is my best friend, also my classmates.
But in terms of legacies, if you can use the words, what do you think that you leave to the people in Taiwan, also to the health community in Taiwan?
Well, at least in my terms, I solved a crisis in the AIDS. Yeah, I solved the crisis in AIDS. I keep the national health insurance going very well. Yeah. And also I keep the H5N1, the avian flu outside Taiwan.
That's right.
I keep it very well. I got it very, very, very well. And also, I love Taiwan IHA.
Yeah.
I love Taiwan IHA. We established a very good model and to help the rest of the world.
Yeah.
I'm really proud of my men
Yeah.
in doing this kind of contribution.
And if you have any suggestions to your successor, what would be the challenges that Taiwan will have to face when it comes to health issues?
Yes, Taiwan become part of the global village. And from the trend, Taiwan should be involved more and more in international health issues. We cannot expect, we cannot escape from our responsibilities.
Yeah.
Yeah, because if economic growth is going to happen, then we have to play more vital roles in the international communities.
That's right.
So will be more challenges on international demand. Will be Taiwan will be asked to give more, to donate more, or to play more important roles in international community.
And also there will be a greater cross-strait integration.
Oh, yes.
Do you think that would be also a challenge for Taiwan?
Oh, yes. Yeah, because not only in terms of economic growth or something like that, will be also a challenge to the public health. Because if the communication between the straits is become more and more, then the the infectious disease the possibility of infectious disease will become more and more. And I know we want to know more things about what's happening inside mainland China.
Yeah, that's right.
Yeah, because there are so many diseases also happening inside mainland China. Still, we do not know, such as avian flu, enterovirus epidemic, or something like that. So, if you allow me to say, there is a chance to talk to the Peking government. Anytime, anywhere, a health professional in Taiwan love to talk to them. We can sit down,
put aside political issues.
We can establish some communications purely on health issues.
That's right.
That will help both sides.
That's right.
Help the people most.
Again, a disease respects no borders. That's right. And thank you very much, Mr. Hou, and thank you for your efforts to Taiwan's health. Thank you.
Yeah. Thank you. Thank you very much.
And thank you for watching Taiwan Outlook, and this is Chi Chen Lo, and see you next week.